Thank you for joining us this morning. I think we all are fully aware that every minute, every day, every second, new information about COVID-19 becomes available. We are seeing all across the country and all around the world, different communities, different organizations, different nations taking action on COVID-19. I think we all share the concern that has been expressed all around the world about what this COVID-19 virus means and how it impacts us as a community. We are committed to being open and transparent and sharing information as we become aware of it. Even though we may not have all answers, we are committed to sharing it with you what we know at the time that we receive it. As you all know, Mayor Kawakami had issued the notice that we became aware of 2 positive COVID-19 cases on Kauai. And I'm here today to give you the information about what we know about that instance. I just want you to be fully aware that, as is our policy, once we get the case, we work through what their itineraries were, who they may have come in contact with, and we make anyone that we are aware of aware that they came into contact with someone who was COVID-19 positive. So the 2 individuals, an adult male and a female, traveled from the mainland on a direct flight to Maui, arriving on March 2nd on United Airlines. They stayed at a hotel in Lahaina from March 2nd through March 8th. Shortly after arrival, Case A developed a fever, cough, and shortness of breath. On March 4th, Case A was seen at an urgent care facility and given a rapid flu test that tested negative. And on that same day, Case B started feeling ill. On March 7th, Case B was seen at an urgent care facility. On March 8th, both flew on Hawaiian Airlines Flight 149 to Kauai. From March 9th through the 13th, they stayed on Kauai. On March 9th, Case A was seen at an urgent care facility and prescribed antibiotics on Kauai. On March 12th, Case A was seen at Wilcox Memorial Hospital. And at that setting, they informed the healthcare professionals that they had a close contact with an individual that was COVID-19 positive. As such, we took samples on the 12th. We are here on the 13th delivering this report to you. They were confirmed as positive for COVID-19 last night. And we didn't hold this press conference last night because we thought it was a little late in the evening to do that. We are aware that 3 healthcare workers who treated them were not wearing appropriate personal protective devices, so we have contacted them. They will be in quarantine or isolation, self-isolation, as we proceed. We do know that this is a rapidly changing situation, and we are committed to keeping you informed. I did want to report on our community sentinel testing. We completed the test on all 62 samples in that first batch of community testing. All 62 samples were negative. We did not find any other evidence within that sample of COVID-19 in any community. It was a statewide sampling, samples from every county. So we continue to believe that the Sentinel testing program allows us to get a sense of community spread. It is not proof positive explicitly because it's only 62 samples. We will be expanding that to arrive at about 200 samples a week that we will be testing from all around the community. As you know, we've been focused on expanding testing all across the state. There have been a number of facilities that have begun to stand up testing centers. We are committed to having expanded testing on each island. Obviously, our state lab is the only lab that can turn around a test in a single day. All the others would incur delay in getting results back. And with that, we're open to questions that you might ask.
Where and when did that close contact with the COVID-19 positive individual happen for A and B?
Yeah, we don't have that information. We're following up with the health departments in that community.
So it's on the mainland somewhere?
On the mainland, not here in the islands.
Could you share what state the couple came from? Are they a couple?
They are a couple, right? And we can provide that information as we get it.
So, were they staying at the Kauai Marriott when on Kauai?
They were staying at the Marriott on Kauai.
Governor, for the two individuals while they were on Kauai, what sort of message do you have for folks who believe they might have come into contact with these two, given the information that you gave to us? What would you expect
Sure.
to call from tonight?
Certainly, we are working with the two individuals to get as detailed an itinerary as we can. And as we are identifying places that they went to, we are contacting the restaurants or tour activities to inform them that they have come into contact with someone who has tested positive. We are telling people that if they had a direct, prolonged personal contact, so it's contact for more than just passing, that they should self-monitor. If they have had prolonged personal contact, then they should isolate for 14 days and monitor their health, take their temperatures twice a day to see if they develop symptoms, then they should see their healthcare professional as soon as possible and inform them of the potential contact.
You said the couple is in isolation. What is their physical situation
They
now?
both have improved so that they do not need hospitalization. So the county has established an isolation. We are in the process of standing up isolation locations in each county so that if there are resident or visitors who don't have anywhere to be, that they have a place to be in isolation.
Can you tell us the age of the couple?
I don't have that information.
Where did they fly?
From to Maui on United Air on March 2nd.
We don't have that information.
Where were the health workers not wearing the proper PPE?
Yes, we've contacted them personally. So for those who had direct contact, the individuals that were in contact have been notified.
Will they be tested?
If they develop symptoms, we again ask them to isolate, monitor their health. If they develop symptoms, then definitely see their healthcare provider, and then we'll be able to get testing done.
Do you know about how many workers were potentially exposed from the people who were treating them?
We are contacting all facilities that we are aware of that they visited and contacting the facilities with as much information as we can so that they can inform anyone who came in contact with them of the potential exposure.
So that was urgent care on 2 islands and Wilcox.
Yes.
Where
And
are
why
they
did
being
go to Wilcox?
quarantined at the Marriott? Where are
I beg your pardon?
they being quarantined now?
They are in a isolation facility that the county of Kauai has established.
Where is that?
I don't know that information.
Do you know why they went to Wilcox?
They were feeling sicker than they were previously and therefore visited Wilcox.
What about the other pending tests? There were 7 total that were pending last night. So what about the other 5? The results for those? All of them negative?
All negative.
We've heard reports that a couple of sailors from the Port Royal were possibly being tested or in quarantine. Can you confirm or not aware of that at all?
testing capabilities right now? Does Kauai have the ability to test, and are Maui and Big Island going to be getting testing facilities?
Certainly, many healthcare professionals can take the swabs and samples that we need to test, right? The state lab here on Oahu is the only facility that can do the test in state. There are private labs who are taking samples and shipping them to the mainland for testing, and then those will be returned. Obviously, there will be a delay for those samples because they go into the queue in whatever state that is, and they are handled and then sent back.
Governor, and just in that respect,
I just wanted to thank Senate President Ron Kochi and Representative Jimmy Tokuoka, who obviously are from Kauai, and they've been kept abreast of the situation.
and it's not about the Kauai question, but to the question of the tests. So while the private labs currently need to send it to the mainland to their certified labs, they are in the process of trying to get certifications here, but it is a 3 to 4 week possible process through the CDC to get that certification. So we're confident we'll be able to get a lot more testing done here, processed here, and turn around a lot quicker than it has been so far.
That's for Kauai. Are we looking to do that on Big Island and Maui as well?
You know, certainly we are working to develop expanded testing capability here in the islands. You know, our state lab is working with the private labs to help them get certified. You know, we are expanding opportunities for people to get work with a healthcare professional to get a test ordered. But obviously, we are expanding that. I mean, you know, the state has their lab up and running. We're working to certify the private labs. Until that time, then whatever is tested by private labs are being sent to the mainland.
Other hospitals, I'll just fill in a little bit on that, as much as I know. A number of hospitals are setting up screening and testing facilities, including Quain's here. They are able to evaluate a person's health. You have to have symptoms in order to get the test, but they can then evaluate the person's health, and if they feel it's appropriate, then they can take a swab sample and have that tested on the mainland. There are 4 hospitals that I know of here on Oahu. There's one up on Kauai that's already ready to do the testing, and I understand a number of other hospitals are planning to open up screening facilities. Again, these would be for people who have symptoms. So if you don't have symptoms, people are being turned away. And people who do have symptoms, though, can now be tested. It takes a few days at least to get the results back, and sometimes a week. But that is going to be helpful to us in getting more information on what's happening around the state. Those labs have to report to the health department any positives or negatives. So in addition to the Sentinel surveys, we're going to have the information from these private facilities coming to us as well.
There have been reports about the mask, the people panicking about mask buying, that it was shortening what was available to healthcare facilities. Is there any indication that that's why the people didn't take
No,
protection?
I mean, we are working with all of the facilities to make sure that they have sufficient inventory to protect themselves. We have escalated that as a priority issue at the national level, and they certainly are making available emergency response stockpiles so that we are getting masks and other protective equipment and getting them to the facilities. I am not aware of any facility not being able to have the protective equipment for their employees at this time. But, you know, we are working very closely to ensure that we know that our healthcare workers are on the front lines of this epidemic, and we want to make sure that we keep them safe.
At what point would you consider deploying a disaster medical assistance team to like a neighbor island or somewhere else?
You know, we are constantly reviewing that. Obviously, you know, it's about demand for services, and if there is a need, then we would look at doing that.
Boosting services at all in terms of like having to contact all of these people now staffing, or do you increasing the resources dedicated to that?
Well, I mean, obviously, you know, we're in flu season, and so all of the facilities have the normal rise in cases of flu. And so certainly our hospitals have been receiving those. I am not aware of any facility that is full and unable to take additional patients at this time.
No, as far as the people who are being contacted who may have had potential exposure to this Kauai couple, is that in the dozens, the number of people who need to be contacted, or is there nothing?
You know, we continue to interview the couple and find out the places that they went, the tours that they went on. We contact those providers and inform them of the time and date of the engagement and discuss with them to identify any prolonged contact that they may have had. So certainly we encourage them, if they had prolonged contact, to self-isolate and to monitor their health, and should they get symptoms, to get tested.
How many more tests have been done as of today?
What's that
How many
question?
more tests have been done as of today?
I don't have, obviously we started the private testing, so we don't have any of those results back. Bruce and Sarah?
We had the State Health Department has tested about 30 to 40 individuals who were seriously ill. These are people who met the CDC definition, and in addition to that, we've just run over 60 samples in the Sentinel survey. Those are all being done with the same testing procedures. We did get a waiver from FDA to allow us to do that survey, and we are again going to be testing at least another 100, maybe even 200 samples as part of that Sentinel survey. I understood that already the private laboratories are processing many samples. Queens alone was collecting 30 or 40 samples the day they opened, which was a couple of days ago. I imagine they're still processing samples, and I know Hawaii Pacific Health hospitals are also processing samples. So we're going to get a lot of new samples coming in over the next week or two, both from our work and from the private laboratories. And that should enable us to really get a much better feeling of what's happening out in the community. The real good news, as the governor said, in the sense, is that we have not seen any signs so far of community spread. We can't say there isn't any, but at least these results are helpful to us. And I would just urge again that this is the time that we really need to take strong preventive measures. Maybe the governor can speak to that too.
But Dr. Anderson, can you clarify how many test kits are available in the state so far?
The original test kit that was sent to us enabled us to do 300 or 400 tests, depending on how we did the tests. As we do the Sentinel surveys, we are able to do batch sampling, and that helps increase the efficiency of the test, so we can stretch that out a bit. We've asked for a couple more test kits already from CDC, so we expect our capacity to handle serious cases will continue to increase. So far, that hasn't been a limiting factor. We've been able to do all the testing that we needed to do of the serious cases, those that are most important to test here.
Well, the national transmission, though, a Colorado health care worker believes that she got it here in Hawaii. She was here for more than 2 weeks on 3 islands for a medical symposium. Have you folks been in touch? She was diagnosed as positive. Has Colorado been in touch with you folks? Are you following up with any of that?
You know, we have lots of conversations between departments of health all across the country, CDC. When we become aware of COVID-19 individual positive that visited any other state, then we do provide that information to the states, and the other states are providing information when they are aware of a COVID-19 positive case who visited Hawaii. We are informed, and then we follow up on any contacts and any and all contacts that we have.
So you folks were made aware of this call?
I'm not about that specific case. I'm not certain whether we have, but we are in dialogue all the time with all the states.
I have a question for Dr. Anderson. The Kauai couple that was recently diagnosed with COVID-19, were they denied a test on Maui by DOH?
No, they were not. They did not request a test while they were on Maui.
The source says that they had requested a test but were denied on Maui.
No, the physicians in the urgent care centers were unaware that they had been in contact with a confirmed case. Had they been aware of that, I'm almost certain they would have ordered a test to be done. That stresses the importance of anyone who was in contact with a confirmed case should be notified, and they should in turn notify their healthcare provider if they develop symptoms. In this case, that didn't happen until they went to Wilcox, and at Wilcox they mentioned, oh, by the way, we got a call that we were in contact with a confirmed case. So that's of course when the Wilcox physicians determined that it was critically important to get those two tested, and they were tested quickly, and of course they're in isolation now.
Do you know when they were made aware of the exposure? Like, did they find out while they were here on holiday?
The day they went into Wilcox.
And they're traveling as individuals, sorry. They're traveling as individuals and not part of a group, the couple?
Are there any deaths in Hawaii currently being tested or investigated for possible from COVID-19?
We are not aware of any deaths in Hawaii due to COVID-19.
That are being tested that could possibly be COVID-19 related?
No, well, I don't know why we would test someone who has passed.
There are procedures if someone were expected or may have been exposed to a case. There is a way of testing for those individuals, but fortunately we haven't had that situation occur yet. Again, the only cases we've had so far in the state of Hawaii have been cases where they were exposed somewhere outside the state and become ill when they were here in Hawaii from that exposure.
So do we have any cases in that instance that are currently being looked at where someone had taken a trip somewhere, came home, got sick, passed, and now it's being tested for?
No one's passed here that was infected that we know about.
Kauai lawmakers perhaps speak to residents on that island who may be anxious. We're seeing long lines outside of Costco and everything else. Could you speak to community members?
Yeah, so, Representatives Morikawa and Nakamura wanted to be here as well, but they're back on Kauai. But I called Senate President this morning, and of course we're here because we want to communicate to our constituents, the people on Kauai, in the abundance of caution, if you're sick, stay at home. Stay at home. Mayor Kawakami put out a press release on Wednesday, I believe, shutting down services for the county, and he got criticized a little bit for it. But given what's happened recently, we have to be cautious with this. We need to thank Dr. Berryman on Kauai, the health administrator, Jen Travanovich, the CEO at Wilcox, and Mayor, because we're trying to do as much as we can to protect the people on Kauai, and we're not taking this thing lightly. We're not worried about, oh, what if we say these things and people don't go shopping and people don't go out to restaurants. We want to support the restaurants and our businesses, but we want to make sure everybody's healthy. So please, when people are sick on Kauai or anywhere else in the state, stay home. Stay home. That's the best way we can stop this pandemic.
Kauai and Maui have both shut down some county services,
Sure.
Gyms, pools, public restrooms and whatnot. Is that something that the state could possibly want to implement across the board to try to stop this
Certainly,
spread?
we are looking at all state services and making determinations about appropriate policies and actions that we can take to keep our community safe. I just really would want to emphasize that keeping our community healthy and safe is a team activity that requires the support of everyone. If you feel sick, you should stay at home and not have the possibility of infecting other people. If your child is sick, you should keep them at home so that they are not going to schools and potentially infecting others. We are implementing a series of actions that are looking at social distancing. I want to commend the legislature, the House and Senate has been very proactive in taking actions to limit the interactions in our community. I think everyone is looking at what the current situation is and really making the recommendations that we believe is in the best interest of our community. You know, I am glad at this point that the Sentinel surveys say that there isn't widespread COVID-19. We will continue that activity because it informs us, it lets us know if there is COVID-19 circulating in our community. Every case that have been positive so far is travel-related, someone visiting an area that had community spread of the virus. You know, we continue to be vigilant, and let me just say we are taking actions that are more aggressive than may be suggested because of the number of cases or because of those who tested positive. We do believe that that's in the best interest of our community to reduce the risk of large gatherings and of a sick individual going to a gathering and infecting others. You want to say?
Well, not just to the residents of Kauai, but to the residents of the state. About a month ago, I literally almost ran into Dr. Anderson and a group of DOH employees as they were leaving the Capitol coming back. When I got to the airport 20 minutes later, I received a call that someone posted on Facebook that there were 4 confirmed cases in Wilcox Hospital. I immediately called Dr. Anderson. He assured me that was not the case, tried to get out on the radio to let them know that what was being posted was inaccurate. And having been the council chairman during Hurricane Iniki, one of the biggest problems in these situations is false or incorrect information. It's way more complicated with social media, smartphones, and access to information instantly today. Department of Health says, please go to our website if you want the most accurate information. Everyone is asking what is going to happen to the schools. The DOE says if you just look up DOE, their website will pop up. If you click on COVID, then they will give you the latest update about what is happening in our schools. So go to the trusted website of the DOE. Go to the trusted website of the Department of Health. Let's not get our community in a panic in social media with information that is not correct. And that's why I appreciate the governor and I appreciate Mayor Kawakami getting you what you need to know as soon as they can, even if they can't answer all of the questions before rumors start out in the community. Part of the reason I'm here today is I have been meeting with the Speaker, with Chair Luke and Chair Dela Cruz. We are trying to assess what we need to do. On Monday, I think Wilcox Hospital went from over 20 points of access to 3, and they started screening, not taking temperatures, but they were already moving in a direction in case we needed to limit access and create safety. So Kauai, having gone through Eva in '82, Iniki in '92, 9/11, we are disaster tested. Our community has a resiliency plan in place. We were the first under Obamacare to get the statewide plan adopted, and so we have that cooperation between the state, the county, and the private sector. So I am confident how the people of Kauai are responding. Everybody, should be following suit, and I cannot stress how important that is. The comptroller already issued a memo either yesterday or Thursday, essentially canceling all large gatherings at the Capitol. The Senate has removed chairs from our hearing rooms to create appropriate social spaces for the hearings that we have been conducting. We've set up TV monitors outside of our conference rooms so you do not have to go into the room with the confined space. We've set up sign-up tables so if you are outside and you're not comfortable being in the room, that you can make sure you'll be called, so if you want your voice heard, you can be heard. But we are trying to think what is the most appropriate way for us to continue going forward as the legislative body while trying to ensure the public safety. And we will be issuing a statement hopefully by Tuesday as to what are going to be the next steps going forward for the legislature, putting the people's health interest first and foremost over anything else that we need to do.
You mentioned the DOE. I know that some of the schools have now canceled prom, Kahuku, Kailua, just to name two. Is that something that's been across the board mandatory for the time being for those events to be canceled?
No, so we definitely are working with the Department of Education, and they will be providing specific guidance. You know, at this point in time, we do realize what the impact of closing a school is on our community, the cascading impacts that would have. And at this point in time, we are focused to maintain school being open. You know, the mayors have asked that we have any conversation before deciding to close the school, so that that we can plan for a closure. Obviously, we are looking at the results of tests, and if there are clusters of COVID-19 in certain communities, then we would take appropriate action to keep those communities safe. You know, we know that Hawaii has always been a place where we come together under crisis. You know, we know how to work together, and clearly COVID-19 is another example of a situation where we all need to come together to do our part to keep our community safe. It is about, if you're sick, you should be staying home. If your children are sick, you should be staying home. Everyone needs to wash their hands more frequently, avoid touching your face. We are suggesting other ways to greet each other, because I do know that our custom and tradition is definitely not good in the COVID-19 environment. So we are adapting to what those changes are. But I'm confident that we will come together as a community, do the things that are necessary to keep our community safe, and most importantly, eradicate COVID-19 from the state of Hawaii should it ever get established.
Just to clarify, are schools making it mandatory that proms or events?
I do not, yeah. As the Senate President said, you know, you should check the website. I have not checked the website. I do know that as decisions are being made, they are posting. I know that individual schools are looking at all of the activities and making decisions. The superintendent is providing guidance to the schools as appropriate. You know, and we will definitely revisit the notion of closing schools. We are in spring break, and certainly we've sent out guidance. You know, we encourage people to look at whether travel is discretionary or not. We do know that there are many coming back from college, and once again, we encourage them to be conscious of their health. If they develop symptoms, they should talk to their healthcare provider. If they are coming from an area that has had extensive community spread of COVID-19, then they should self-isolate until we can get through that 14-day window of self-isolation that everyone is recommending. Obviously, if they get sick, they should see their healthcare provider. And if we all can take the actions that we individually can take to social distance, to keep ourselves healthy, to maintain and increase hygiene, then I think we can stop the spread of this virus in our community.
Is there an update on the first two patients, the presumptive positive? How are they doing? Have you gotten CDC confirmation?
We have not yet gotten CDC confirmation, although we're very confident that that's just a formal process at this point. We know that one case is still quite severely ill and remains hospitalized. The other one is recovering, so we're hopeful that person may be able to be released from isolation soon.
Was it supposed to take this long, the CDC confirmation, or is there sort of a backlog?
Well, remember, they're still confirming all cases for all states, so they're, you know, we know that they have received our specimens, so we anticipate they will be able to give us the confirmatory results anytime now, but we haven't yet received that. So.
I think what's really important, though, is we are treating it as a confirmed COVID-19 case, and there's nothing that we would do except for those actions that we need for any confirmed confirmed COVID-19 case. So the confirmation from the CDC to me is more administrative. Every action that we've taken assumes that we are accurate, and we're pretty confident that our lab is accurate, that they had, sure, that they were infected with COVID-19, and we are acting in that way.
I can say that CDC has indicated to all state epidemiologists that very soon now they are making, they're likely to make recommendations that we will no longer have to send specimens for confirmatory testing. So again, we're pretty confident in our testing capabilities here, and as the governor said, it doesn't change what we would do. As soon as we have a patient under investigation, we're investigating all contacts, we're notifying people, alerting folks that we need to be notified. We're checking with healthcare providers who potentially are at risk, and frankly are usually going to be the ones at most risk because they will have had that close contact with individuals that put them at risk. And then just one note about the 2 current cases. The confirmed case that they were in contact with was a close contact. It wasn't a person in passing. It was someone very close to them. So.
Dr. Mark, according to the lack of disclosure in Maui, is that something that are we going to mandate disclosures of close contact, or is that already the procedure?
I mean, you can't force people to say something or to, we don't know at what point these persons were necessarily informed or what happened, and we're investigating further because, as has already been said, had we been notified that these persons, by the healthcare provider, that, these persons had a known close contact with a confirmed case, that would fulfill our current criteria for, testing that individual. So we are investigating further just to gain further understanding of what happened, but it doesn't change what we do right now. We are investigating each and every potential contact, whether close or not. We're courtesy notifying anyone who has had any engagement with these 2 individuals to make sure they are aware, and to, in many cases, reassure them that they have low or no risk, but also to let them know they should be monitoring themselves still, and let their healthcare provider know if they have any questions. And again, if people have mild illness, please help spare our healthcare providers out there. Stay home, as well as our community. Stay home. Keep your germs to yourselves. The only exception really is if you have underlying illness or you're an older individual. Those persons, if with any illness, should call their healthcare provider sooner than later, just so that their healthcare provider knows and can give them the appropriate recommendations. But for everyone else with mild illness, please stay home. If you have questions, call your healthcare provider. Make sure they know about your history, by the way. That's the other thing. That's true for all residents and visitors. If you know you've been in contact, you've been notified you've been in contact with a confirmed case, make sure your provider knows. If you've traveled from someplace, anywhere at this point, please let your healthcare provider know that immediately.
Would you have changed their advice for if the couple was coming from if for example they were coming from Washington State, where there's been more widespread community, would you have suggested that as soon as they went to an urgent care center that they would have said that?
At this point, honestly, our recommendation for anyone, and this would be COVID, during this COVID environment or not, frankly. I'm always reminding everyone that anytime you travel, that travel history is really important to the provider you're seeing. They don't know that you've traveled unless you've told them. So that's a first thing. As far as does that matter in this case, to a certain extent, yes, because we're seeing so much, around the U.S. There's so much that we need to learn, and so any little bit of information is really helpful, not only to the healthcare provider but also to us in public health.
Okay, we're going to need to wrap this up, so one last question, and we're going to wrap.
Well, we're streaming, and people are asking, why are we not testing people coming to Hawaii, especially if so many of these cases were coming from visitors? Are we going to be getting heat scanners at the airport?
Our experience is that screening people at the airport is not effective, that it requires a lot of resources. We get thousands, tens of thousands of visitors at the airport each and every day. For us to test, we talk about testing capacity of 500, and we're going to test 1,000 people coming in from all around the world. That's really not a practical solution. You know, we are encouraging, we provide information to visitors should they get ill, that they should contact us. We provide them contact information for medical services. You know, we certainly encourage them once they are ill to inform us and inform where they're staying. We're working with the tourism authority to ensure that they have the information that they need. So that anyone who becomes ill can get the services they need.
So we're going to wrap this up. That's the end of the press conference. If you have any further questions, go ahead and send them request to the Joint Information Center, and we'll get those answered for you.
Yeah.